While Dr. Miles is focusing on discovering new cancer-fighting compounds, his work holds promise in the treatment of many other diseases, including tuberculosis and Parkinson's.
As we age, doctors work hard to treat the aches, pains, and illness that can hamper our quality of life. But another aspect of treatment involves our mental health.
Denise Gammonley is doing research into nursing home care for older adults. Thank you so much for joining us today, Denise.
Thanks, glad to be here.
And it's a much broader umbrella than that. I mean, we're talking about social work really in nursing homes, and in particular older nursing home patients with mental conditions.
Right.
Give us a little bit more background on this.
Right. Well, my research area focuses on older adults that have had mental illnesses for many years, typically most of their adult life. And what I'm looking into is the quality of care that they receive when they enter a nursing home, and particularly the kind of care that we call in social work psychosocial care.
So how lucky are the ones who actually are in some place where they're safe and they're cared for, though?
Well, that's a good point. You know, many older people with mental illnesses that are living in the community live somewhat marginal kind of existences. But as people age and need sort of physical health, attention to their physical health needs, for a proportion of the people in nursing homes, they will have mental health issues. It's about something like 12% of people that live in nursing homes have a history of mental health treatment throughout their life.
And that raises the question of our whole system, and obviously this is a much bigger picture than we can work on in just a few minutes in this program, but the people who need the help have a difficult time, as you mentioned, getting it when they're younger and relatively healthy.
Right.
Here they are getting older. They're starting to have other conditions that develop as they age.
Right.
And there's no way to really facilitate, at least up to this point, hasn't been really a good way to facilitate the transition into a nursing home environment.
Right. And that's where sort of the role of a social worker as a professional social worker comes into play. And that's one of the things that we do and I'd like to say do really well, and that's to help families and individuals adapt to changes in their environment. So what I'm looking at, for example, is how individuals that have mental illnesses, once they enter the nursing home, what can we do to help them adapt to that situation? And one of the things that they need to have access to is continuing treatment for their mental health and psychiatric kind of issues.
Do they need specialized facilities, or can they go to like you say, there's 12%. Obviously, there's not specialized facilities for just senior citizens with mental health issues. Well, how does that work?
Well, one of the things that we're going to look at is just what kind of care they receive. We're going to be looking at, in our study, all of the nursing homes in the U.S., which is we're talking 16,000 facilities, 1 million beds, okay, and looking at just what kind of services are these folks receiving, because really we don't have a good understanding from the perspective of the whole nursing home population in the U.S. what they need. So we'll be looking at their clinical sort of issues, their well-being and quality of life, and in particular we're going to look at the quality of the mental health care and psychosocial care that they receive while they're in a facility.
Can you clarify for me the term social worker? I mean, so often we associate that with, you know, the stories we'll hear in the news about the social workers took the kids away because of treatment in the home. How is this role currently set, and how is it evolving?
Right. Well, the profession of social work implies that a person has at least a bachelor's degree in social work at a very generalist kind of basic level. And then most social workers choose to specialize and get advanced training at the master's level. And social work is licensed and regulated in virtually every state in the U.S., including in Florida. So at our UCF School of Social Work, we provide a master's and a bachelor's program. And our master's program really provides students with the opportunity to specialize in clinical social work.
You had mentioned the actual patients, the seniors in the nursing homes. However, there's the other side as well, the workers. I've read that actually working in a nursing home makes it the 4th most dangerous job in the country with illness and hurting, mostly back injuries they're getting. So I can't imagine if that many people are coming in with a mental illness. Most of these nursing home workers are probably not equipped to even begin to know how to deal with them.
Right, and that is a huge concern, and in particular in nursing homes, turnover of staff is a huge issue. You know, where it's like 200% and 300% per year turnover. So the role of a social worker in a nursing home can be one that's really important, not only to help the residents and their families, but to help staff members who have less academic training in mental health and psychosocial care to work with those residents. And that's really a key piece of the social worker's role, is to help the staff who might be struggling in relating to an individual, for example, that has a mental disorder, or helping staff during team meetings make care planning decisions on behalf of that resident.
Are we looking at this as a multi-level approach for care? I mean, it seems like right now there's a gap. I mean, you either need a little bit of care, or suddenly you're put into that pool where you need a lot of care.
Right. Well, the reality is that the vast majority of older adults are not in nursing homes and don't need that kind of care. And what we've seen over the last many years now is an increasing range of choices of levels of care. So now we have assisted living, we have day programs that are very helpful for many families, because most families, of course, want to keep their loved one at home or in the community, and so there's a huge range of options now available. In some respects, it's sort of too many options and can be very complex for families to figure out where do we go and what's the best choice.
I bet you feel really so lucky to have gotten a grant to be able to look into this and help people narrow that down and give us more information.
Right, right. Well, I've got some funding from the Hartford Foundation Faculty Scholars Program in Geriatric Social Work, so we're going to look specifically at how we can understand and the role of the social worker in the nursing home.
Well, we're going to take a short break, and we'll be back with Denise in just a moment. Right. Don't go away.
Attendance, people, listen up. Albertson.
Here.
Barnes.
Here.
Swain.
Here.
Reyes.
Here.
Perez.
Here.
Clark.
Here.
Gerbic.
Here.
Sellers.
Here.
Nguyen.
Here.
Tomei.
Here.
And Miller.
Here.
In our classrooms and throughout our community, UCF stands for opportunity.
And we are back with Denise Gammonley talking about mental health care for older adults. And certainly all of us, we look at our parents and we get very concerned about their mental health, their status. You kind of look out for the certain signs and this sort of thing. But for those who have loved ones who perhaps have had long-term mental health issues and care that they've been working on, are there things that they can do at this point in time to prepare, to be ready for the eventuality that their loved one may have to be put into a facility?
Well, much the same for any other individual. Advanced care planning is something that's crucial, especially when a person has a disability like a lifelong mental illness. So family members, continue to really take an active role typically in the lives of people that have serious mental illnesses. In particular, the research shows that siblings of individuals with mental illness, play an important role as that person ages. So anything that they can do to ensure that that person is receiving the optimal care in the community for their psychiatric disorder, as well as their physical health concerns, which can go unnoticed if the person's psychiatric disorder is so severe that it prevents them from sort of attending to symptoms that they might have. So families face a lot of challenges, especially when a person has a mental illness.
You did work in rural North Carolina.
I did.
And my husband's grandfather was in a nursing home facility in a very small town in Nebraska. And we'd go visit, and the kids would go visit. And because it was a small town, they'd known him his whole life. You'd go in, and it was a very welcoming place. Everybody knew each other, and the care was excellent. And there were all different levels. There were people who were there, you know, who really needed a lot of care, and people who didn't need as much. Is there a difference between these small rural towns versus a big city where there's a bunch of strangers and people hired for wanting to make more money, maybe not prepared for what they're going to go through? The people working at this nursing home were, you know, friends and neighbors.
Right. Well, I think you know, there's sort of an image of rural communities being very supportive and having a lot to offer, but also recognize that access to healthcare services can be much more challenging in rural communities because there are fewer professionals to provide it. So maybe in some respects, in larger urban centers.
And the hospital's far away?
Exactly. But you're right, I think there is this image of, you know, smaller is better. And one of the things that we have in the state of Florida is, of course, a whole range of care settings, from small 1, 2, 3 bed, what we call mom and pop kind of setting, board and care kind of settings, to large 240 bed nursing homes. And I think what families need to really focus on is what fits for them and what fits for their elder. If their elder has always been involved in very small kind of settings and is not particularly social, a smaller setting might be most appropriate for them.
I may be asking the same question in a different way, but with the move toward trying to contain healthcare costs, more and more institutional type facilities are coming along and kind of swallowing up the mom and pops, if you will. Can we avoid that? I mean, is it going to get to a point where we only have the larger type facilities because of the cost, because of the sheer volume of dollars that are involved to take care of someone?
Yes, and it's true. It is a huge social cost to care for an aging population that needs medical and nursing home care. One of the really exciting movements in long-term care and nursing home care is something called the culture change movement, which has to do with trying to really transform systems of care from the bottom up. And some of these initiatives are really taking place now across the country. There's something called the Pioneer Network, which is an alliance of nursing home providers, professionals that work in that industry, and families and residents, to try to create a culture of more home-like kind of settings. And there's some really innovative ways that's being done. There's something called the Eden Alternative, which is changing the whole sort of architecture, you know, building architecture and structure of nursing homes as facilities, so they're created as more as small home-like environments.
Because this becomes their home.
Exactly.
And they're not necessarily in need of a hospital, so they probably don't want to live in a hospital-like environment. I wouldn't want to.
Exactly. And you know, when you start talking about nursing home care, you're talking about individuals who enter an institution that have a prescribed meal time, a prescribed time to get out of bed, a whole series of sort of regimented events during the day, and that's not how most of us live our lives. So why would we want to live our lives that way when we become older and have become more dependent? So the culture change movement is a way to try to create that more home-like atmosphere.
Are those where the people are? In other words, if I'm in a particular community, will I be able to find a connection that will keep my loved one in that community where they might feel more comfortable?
Right, and close by. You know, 'cause family members may not be able to provide the hands-on care, but having sort of a place in your neighborhood where your mom or dad is 2 blocks away that you can go and be a really integral part of their care is
and you talk about culture change, using the words a little bit differently. In our society, unfortunately, and I hate to generalize or start a sentence like that, however, we don't really tend to honor the aging folks as much as maybe some other cultures do. And I'm hoping that now that the generation that has been in control of so much, now that they're getting older, maybe that'll change.
Yes.
Do you think?
Yeah, certainly. I mean, you see that if you just look at the commercials on the television, that you'll see baby boomers aging, and that's sort of being celebrated, I think, in a different way. So I think we're really, you know, on the cusp here of a transformation, because sheer numbers of people living into later life. And so the idea is for us in the aging business to figure out ways to make them have a better quality of life.
If I'm healthy enough that I live to 90, I'm going to demand respect.
Okay.
And deserve it
He does
too,
already.
probably.
He does.
Okay.
Denise, thank you so much for joining us.
Well, thank you very much.
Such interesting information, and information we'll all be able to use.
Yes, indeed.
Some of us sooner than others.
Speak for yourself.
Some of the most exciting news in health is coming from the creation of the UCF Health Sciences campus at Lake Nona. Here with our College of Medicine update is UCF Provost Terry Hickey.